But tonight we are learning more about a mass vaccination clinic in Rochester tomorrow and Saturday. However, only certain groups of people will qualify, including home health care providers, school staff, child care providers, and other health professionals. And in order to qualify, you need an invitation and you must be pre-registered. Mayo Clinic announcing today that they're changing their vaccine age requirement from 80 years old and up to 75 years old and up. However, you must wait to be contacted by your provider. The clinic says they are still working through vaccinating all of their own healthcare workers while moving into the next phase and vaccinating those of certain ages. The Wall Street Journal published an article today about this. It is a problem for seniors nationwide, not just here at home. Jim Carlton is a longtime contributor for the Wall Street Journal. The article was titled, "What It's Like for Seniors Getting a Vaccine Shot," and it was published today. Jim, when you put this out, I noticed that you talked to a number of different people for this story. I mean, you featured their stories. Well, what really stuck out for you the most as you were putting this together?
Well, Betsy, and thanks for having me on. Apologize for being out here in shirt sleeves, but
and sunshine. Yeah, really. You're from in San Francisco.
But you know what really stuck out to me is just what a nightmare it is for everybody, really, from coast to coast. It almost doesn't matter where you are. I'm here in San Francisco, and it's supposed to be open to 65, but if you go on the websites, up until like today, you had to be 75 or a healthcare worker. In Chicago, we talked to a woman who is in her late 60s, and it's a lottery system in Illinois, which I think it is in Minnesota too. Is that right?
Yeah. When we first rolled out, about a week and a half ago, it was a lottery system, and then it's been changing a lot, and that's what's leading to so much of this confusion. But before we get to that and the changes, let's talk about that lottery system, because Minnesota wasn't the only state to do that.
Yeah, well, exactly, and this poor woman, so she finally got through on the lottery system. She got the notification. You can register for your vaccine appointment. She was very excited. Oh, yay, I'm going to get it quickly. The earliest she could get an appointment was March 1st. So that's another month, all right? So I talked to a woman in Reno who actually, she's a teacher. She said, I can teach calculus, yet I can't make a vaccine appointment for my elderly parents. And she goes to the state of Nevada website to find out what to do for her 80-year-old parents. Then the state says, go back to the county, Washoe County in Reno. Washoe County then says go back to the state. So it's this big circle thing that I mean it's just a mess, Betsy, everywhere.
Not just to talk about the situation in Reno. That was something I was going to bring up with you, because there are so many of our seniors, as we've been talking about, who may not be computer savvy. So then they have their grown adult children get on the websites and try to do it for them. This isn't just confusing for seniors who aren't computer savvy. It's confusing for a lot of folks, and we keep trying to find answers, but there are changes that keep happening. I don't know if that's the same in California, where you guys maybe had a rollout with a certain system, then it changed the following week, but it sounds like across the board this is a problem.
It is a problem, Betsy, and for example, I talked to another couple in Springfield, Illinois, and they were trying to manage the system on their own, and the woman's 71, her husband's 67. He suffers from multiple sclerosis. He's in a wheelchair, so she's his caregiver. And they couldn't. And when they announced in Illinois that vaccinations would be available in mid-January, she didn't get an appointment until like 2 weeks later, after she got her son-in-law to help. Her son-in-law's in Brooklyn, and the way he got through was like in the middle of the night, getting refresh. Well, then he was able to get an appointment for the husband, but not her. And so she called the county, can I please get in, because I'm his caregiver. They said, no, you absolutely cannot. We will not do that.
Wow.
And so she ended up actually going to get her appointment, I think this past weekend, and through a raging snowstorm, which you'll appreciate, cars sliding off the road, they went through the drive-through clinic, and she actually begged the woman who was doing the vaccinations, can I please have one? And the lady said, yes, but don't tell anyone.
Wow, isn't that something? Jim, if I can get you to hang on a couple of minutes, I need to take a quick break. We're going to come back.
Yeah.
And at the beginning of your article, you pointed out something about the doses that are available and that are going unused. I want to talk to you about that. Give me just 2 minutes. I'm continuing my conversation now with Jim Carlton, who is a reporter for the Wall Street Journal and has written for them for a very long time. He recently put out an article that was published today about seniors and the challenges for seniors across this country for getting vaccination shots. The distribution rollout in every state almost, it seems like, has been as much of a problem as what we've been experiencing here in Minnesota. So, Jim, at the beginning of your article, a couple paragraphs in, it says, as the COVID-19 vaccine is rolled out across the U.S., about 40% of the doses allocated have gone unused so far. As of Monday of this week, 30 states allowed vaccinations in at least some of their counties for anyone over the age of 65. Any chance that you know why we've got 40% of these doses that are going unused?
Yeah, it's a really good question, Betsy. And the problem is that basically the feds turned out they had the vaccines, sent them to the states, and it depends on the state how it's doled out. And so every state has its own rules. And I'm in California. We're at the bottom of the list. We've got a big stockpile of vaccines unused. States like West Virginia are at the top. North Dakota, right next to you, North Dakota is actually, I think, #1 or #2 in the nation. And part of it is the population, but also just part of it is who's got more efficient systems and that kind of thing. So we're dealing with like multiple states, hundreds of counties, all these health districts. So it's kind of a bureaucratic nightmare, and that's why it's so different.
Let me ask you this, Jim. So I caught this article that you wrote. Have you done any other pieces about the vaccine rollout distribution throughout the country with getting any answers from any of the federal officials with any changes? Do we know if any changes are coming down the road?
I think it's going to get better. I just got a text on my cell phone today that I can now get. I just turned 65, so.
Well, congratulations, I think.
Yeah, so I don't know if I want to admit that too loud, but don't tell my bosses. They think I'm 55 now. Okay. No, I was just notified today that I could, go up on a drive-up line and get a vaccine. I actually got one. I went to an adjoining county, Alameda County, which is in the East Bay, and a friend said there's a library they're doing, so I got one. But no, it's going to get better. There's a lot more coming out. So I think we're maybe at the worst time now. So maybe in a couple of months, we're all going to kind of shake our heads and laugh at, the nightmare now.
I hope you're right with that. You followed so many of these different folks and getting their stories. When we show up and talk to people as well, we get their stories. We saw a woman earlier this week crying, and we thought maybe it was because she was turned away, and it wasn't. It was because she was able to get her first dose, and that's what's going to enable her to finally hug some of her family members that she hasn't seen since last March. So this whole situation has been hard, but I really wanted to talk to you about the seniors part of this, because for them, it's even harder and way scarier.
Right, exactly. In fact, you asked if I'd done other vaccine stories.
Yeah.
A story, which is kind of a good news story. I did a story a couple of weeks ago on, I actually went to a retirement home in the Silicon Valley and watched the old folks getting their first shots. And Betsy, you're talking about the tears of joy. There was tears of joy there because they've been locked up since last March or February, not able to hug their family, not even be able to see their friends. And so it's been a nightmare. My own parents are in a nursing home, and I'm from Kansas City originally, just south of you. Not as cold as Rochester, but
you just keep rubbing that in.
But my dad actually was first in line. He was in his walker. He was first in line for the vaccine. He got his first dose about a month ago, and he just got his second dose. And so, it's really sad. It's really saddest for them, though. It really is.
What are you working on next? What's coming down the pike? I can tap into some of your knowledge in the future.
Well, we're talking about school reopenings. That's a whole other can of worms.
Yes, the seniors getting their vaccinations and schools reopening. Those are the two biggest headlines here too.
Yep, yep. In fact, San Francisco, the city of San Francisco just sued the San Francisco School Board because it's going so slow on the reopening plan. So it's a mess, yeah.
Well, I hope that I can tap you on the shoulder and talk to you in the future about some other articles. I appreciate your time, Jim.
Yeah, yeah. So it's great to talk to you. I've been to Rochester before, so my son went to Marquette in Milwaukee, so I drove by there not too long ago. So.
Well, if you come into town, I'd love to sit down and maybe interview you in person. And thank you.
Okay. Yeah, you bet.